The first slide really is to say something about the meeting today. You can see there, and I think after all the talks that we've had up until now, you agree that we live indeed in a world of risk. And this was highlighted some years back in Time magazine when they asked us to consider the world of risk and in fact come up with the hard science, which is what we've been hearing today, to deal with that risk. Aflatoxin itself has also been in the headlines over a number of years. The headlines you see there come from across the African continent. The first one up there on the left, the poison in the peanuts, you may well remember from the problem of aflatoxin in the school feeding scheme. Going down, there's articles in Nigeria from toxic chemicals. There's the kenke causes cancer in Ghana. And those who don't know, kenke is a fermented maize product, very popular in Ghana. And then you'll see the one right at the top right-hand corner there, the Daily Nation in Nairobi. You can see 4th of August, barely a month ago, aflatoxin poison kills Eastern region resident. Once again, the regions of central Kenya are having a problem with aflatoxin contamination of the subsistence maize, and it is leading to deaths in those communities. What is aflatoxin? Why are we worried about it? Well, it's a mycotoxin. I think everybody will recognize this, which means it's a secondary metabolite produced by certain filamentous fungi. And important after all the talks that we've had about pesticides and everything else until now is to recognize that it is in fact a natural product. It's a gift from Mother Nature, and we have to realize that Mother Nature is not always generous to us. She can in fact be a bitch and supply us with these very nasty chemicals which contaminate our basic food supplies. Now, although we can suspect that aflatoxin has probably been around for many thousands of years already, it's only really been known to us for the last 50 years. In fact, this year is the 50th anniversary of the discovery of aflatoxin, which was made in the United Kingdom when all the Christmas turkeys died from some strange disease, which was then termed Turkey X disease. I'm going to have a little bit of chemistry. I apologize, this will probably be the only chemical structure I'll show. But I just want to emphasize the fact that aflatoxin, when we just say aflatoxin, it's really a generic term for what are a large number of chemical species, of which aflatoxin B1, which is the structure you see there on the left, is the most abundant and in fact the most toxic. But there are a number of other naturally occurring aflatoxins which occur at lower levels and which generally may be considered perhaps not as toxic. That is B1. B1 we've had B2, G1 and G2. What happens when these aflatoxin molecules are ingested, they are transformed in mammalian systems and we get detoxification products such as aflatoxin M1. Now aflatoxin M1 is of concern because the M stands for milk. It is the aflatoxin that is excreted in milk, either human milk or cow's milk. And there are a number of other different detoxification forms such as P and Q, but we won't talk about, oops, wrong button, sorry. Just a few words about the natural occurrence of the aflatoxins. And the major producers are really two Aspergillus fungi, Aspergillus flavus, from which the aflatoxin you'll see readily gets the name for the toxin group, and Aspergillus parasiticus. They can occur both in the field before harvest, or they can appear or they can produce aflatoxins in storage. So there's a twofold problem. The commodities, though, as you can see from that list, it affects the staple diet in Africa. Nuts, maize, sorghum. In other words, the staple cereals that are consumed across Africa are the natural hosts for these two Aspergillus fungi, which then go on to produce the aflatoxins of which we are most concerned. Just to give you a rough idea of the sort of levels we're talking about, and I'll come back a bit later to the legislation in South Africa, but just so that you have a feeling for the type of level at which they can occur, in the European Union, the legislation allows aflatoxin levels, total aflatoxin, that's the sum of B1, B2, G1 and G2, to be a total of between 0 and 4 parts per billion. The parts per billion, I will remind you, represents one part in 1,000 million. It is a very, very small number. In South Africa, we have a legal limit of total up to 10, and in the USA, the legal limit goes up to 20. Commercial maize in South Africa. Just to give you a perspective, perhaps, of some of the conditions or some of the local levels that we could see. Well, in South Africa, we're actually quite blessed in one way, and that is our commercial maize. The maize grown here on the commercial farms is mostly free of aflatoxin. So this is part of the good news. The bad news is that if we import maize, in the years we do not have sufficient crop ourselves, we frequently import from the United States. The United States maize crop is, or can be, heavily contaminated with aflatoxins, and it is something which has to be considered when we get to that point. Sorry, I'm going to slide off on those those pamphlets in a moment. So no, I hope not. It'll be a spectacle. Let's see. Subsistence maize in South Africa, they're grown by subsistence farmers. Well, we're not too sure what those levels are because there haven't been many studies, but there is one that suggests somewhere up to perhaps 50 parts per billion may be out there. I referred earlier to the Kenyan problem this year. Well, the Kenyan problem has been recurring over many years, most notably in 2004 when there was a heavy outbreak of aflatoxin contamination, which led to aflatoxicosis, which is the acute poisoning due to aflatoxin, and somewhere in the region of 130 deaths occurred in Kenya. And subsequent studies showed that there were, there were between, between 8,000 and 46,000 parts per billion. This is the sort of level of aflatoxin which kills. Subsistence peanuts in South Africa, again, levels perhaps up to 100 parts per billion. And as for the commercial peanut butter, we'll tell a story about that a bit later. Okay, the introduction to the health effects. Well, aflatoxins are nasty molecules. They're hepatotoxic, teratogenic, mutagenic, and carcinogenic, which is, of course, the reason I'm up here this afternoon. The acute effects, as I mentioned, is aflatoxicosis. It appears as a severe jaundice, followed by with edema, GI hemorrhage, and in extreme cases, death. In the 2004 and 2005 aflatoxicosis outbreaks in Kenya, of those admitted to hospital for the jaundice, around 30% died. So to give you some idea of the statistics. It's immunosuppressive, and from our point of view of cancer perhaps, it's genotoxic and carcinogenic. In particular, it binds to DNA, the p53 tumor suppressor gene. It causes liver cancer in experimental animals. And IARC, I think IARC has been referred to already. It's the International Agency for Research on Cancer. Referred to in the first talk this morning. Let's put that in group 1 and carcinogenic to humans. So we've said it's carcinogenic. It produces liver cancer. The studies that have definitively established this come from a range of studies in China and Thailand, which really go back to the 1970s, 1980s, and in fact are ongoing in China still. They've demonstrated this relationship between aflatoxin exposure and human liver cancer. But the important point that we need to recognize is not only is the aflatoxin a problem, but there's a synergism with hepatitis B.